You hate wearing your dentures, and I know why. When you have your teeth removed and you start to get a denture and start to wear it, what happens over the next few years is that you start to lose a lot of bone. The reason for that is because when you have a denture made, it fits just over your gums and your bone is not being stimulated. Now what that tells your body is that, there's no longer any teeth there, so your body just thinks it's not necessary to keep that bone alive and it keeps going away. Let me show you a little diagram of what I'm talking about. So as we see over here, this person has all their teeth. You can see kind of the anatomy of how the bone structure is. And once you had the teeth, what happens is this is what your mandible looks like, for example, once the teeth. So you still have some bone, but what occurs over the next few years is that you start to lose that bone and it starts to go away. So if you compare this ridge with the other ridge that I just showed you, you can see a big difference in how everything is fitting. Now the problem with that is that you start to lose the bone, but your denture still stays the same. Okay, so that's a problem because now your denture is no longer fitting, and you're like, okay, what do I do? So at this point, there's a couple options, and I'll tell you what they are. Hi, I'm Dr. Kotobash. I go by Dr. K from Summit Point Dental Implant Center, and I want to explain to you why dentures are not the way to go. All right, so number one, when patient comes to me when they're losing their teeth or they've had their teeth removed already and they're already in a denture, the best thing to do earlier on is to have what's called dental implants placed. Even if it's a snap-on type of denture, it's still better than getting a traditional denture because it's still stimulating the bone because you're still putting stress on the bone, and that's what's necessary to keep that bone alive. When you just have your teeth removed and do nothing and just have a denture, like I said earlier, your body thinks that it's not necessary to keep that bone alive. Think of bone as like a muscle. So if you don't work it out, you don't put stress on it, it's just going to wither away. It's going to atrophy. And that's kind of what we see both on the top jaw and the bottom jaw. So in this video, I want to just explain the benefits of getting dental implants, because when you get dental implants, whether they're fixed bridge or if it's a fixed snap-on, you're using the mastication muscles that forces you put on the bone. It keeps it healthy and it keeps the bone alive and lasts a lot longer than if you had a denture. We have a lot of patients and I can show you x-rays of how those look like. Here I want to show you basically what I was talking about as far as what happens to the anatomy of the jaw once you have your teeth removed. On this x-ray over here, with the exception of this one tooth that's remaining, you can see this is where the bone is, in the jaw, and this is the lower jaw, how much bone there is available. This is a person who's recently had their teeth extracted, probably 1 to 2 years, so you still have ample bone available during this time period. But as time goes by, what's going to happen is you're going to see what's going on in this picture. This is a person who's probably had dentures for maybe decades. But this is an extreme example of basically almost no bone to do anything, and even trying to do any type of surgery to recreate this bone level is going to be almost impossible to do, both on the top and this is the top over here, this is the sinuses, and this is the mandible. So very easily prone to fracture. Something like this, as far as the denture goes, not really going to be stable because you need anatomy for it to rest on. And for a lot of denture patients, they use adhesive to keep it in because it's just using your tissue for retention. There's nothing really stable holding it in. Okay, versus if it's an implant supported bridge, we call it the all-on-X, all-on-4 procedure. Basically the prosthetic is being held in with implants and everything is screwed in, nice and slim, not bulky like a denture. And this material could be made out of either acrylic, it could be made out of what's called zirconia, which is very lifelike, very strong, looks almost like porcelain once it's in your mouth. This is the next best thing to having your natural teeth once you're ending up losing your teeth, because as you chew with this, you're putting stress on the bone, and your body thinks that the bone is still necessary to keep it alive, so it stays at a high level, just as if it would be with your natural teeth, as long as you have good hygiene and keeping it clean. This is an example of kind of a patient who's had this procedure done. This is many years after they've had the procedure done. You can see plenty of bone still there, because as they're chewing, it's keeping the bone stimulated and it keeps the bone alive. The spacing underneath that is just the tissue, so it's resting on tissue. There's no gaps underneath it. The gap is minimal, so it's tight against the gums and it's fitted. We do recommend patients that have this type of procedure done to come in regularly, like once or twice a year, to have everything checked. At the dental office, we're able to take this prosthetic off to be able to clean under it, check all the screws, make sure everything's good. But as far as long term, this is, in my opinion, the way to go. It's a little bit more expensive than having, of course, dentures made. But this procedure, compared to a regular denture, it's not really a comparison. If you're interested, I want you to go ahead and click the link below and watch the video on how to click your all-on-4 bridges. Thanks for watching.